Okay, welcome once again. We had a bit of a problem there, so we had to cut. The video was cut very abruptly. So we're just going to continue with speech. Again, speech is a very complicated, complicated, well coordinated ballet. Again, just the mechanical aspects of producing the spoken word is already a marvel in itself, and that even excludes how you understand and how you form words in your head. So again, let's just have a brief recap. You need bellows, so you need your intercostals and diaphragm to force air from your lungs out. It passes through your vocal cords, therefore you phonate. Okay, with those vocal cords, if they're paralyzed, you now have hoarse sound, hoarseness. You have articulation, so your palate, your soft palate, your hard palate, your tongue, your jaw, your teeth, your lips, they all coordinate to create that precise pronunciation of words and syllables. And you have resonance, so your pharynx, your larynx, your oral cavity, even your nasal cavity, those have, air or sound bounces through that, and it gives you your particular sound and timbre, your particular voice. So if whatever voice you have, it's because of how you are made. Some have qualitatively better voices than others, and that's because of their genetics. It's who you are, how your soft palate opens up to let air also resonate in your nose. That is why those with cleft palate, what we call they have that particular nasal voice, what we call in Ilonggo punga. Uh-huh. Okay, so of course there are other languages that are more nasal than others, like the French. Okay, un, deux, trois. Okay, so of course my French is very atrocious, and I probably owe them an apology for that. But you get what I mean. Now, of course, last would be your cognitive direction. That's what I mean. That's where your vernix, sensory speech area, and your Broca's area all come into place. How you understand and how you create. Okay. If you have problems with vernix, Broca's, or both areas, you may not be able to understand spoken or read, or spoken or written language, or you may be able to understand that, but you cannot elucidate, or you cannot express yourself properly. Or what is worse is both. Okay, there's a whole chapter and books, even whole books written about speech problems when it comes to central affectations. But anyway, that's that's a bit too far for us now. Now, a very quick test would be your KLM test. Remember the airline KLM, or if you have Cebuano roots, just say Kalami. Okay, KLM. When you let the patient say k, okay. So when you're able to do that properly, okay, you are basically checking your pharyngeal valve. Okay, what does that mean? K, Q, K, Okay, that sound. Okay, so the ability for your oropharyngeal airway to stop and then explosively let it open. So, okay, your velopharyngeal valve is okay. Next would be la, 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 la. What's that? Lingual. So, your tongue as a part of your speech apparatus is okay. And last is me, me. So, that's your labial or lips. Okay, so there are certain alphabets that go with your check your velopharyngeal valve, like your K, your Q, okay, your M, okay, is labial, your L, okay, is lingual. So that's how you test it. Okay, let's go to your soft palate. Okay, your hard palate is immediately after your teeth. Your soft palate is at the back. Look at this part there. Okay, if you're at home, go have somebody, one you could intimidate or one that you could easily bully around or order around, and check their soft palate. Okay, so basically what you can see there as well, there's your tongue, you have that area there. So this is your soft palate. This here is your uvula. Oh, sorry, your uvula there. Okay, and you let them say ah. Okay, do that and you will find out and you will see what happens when they say ah, because these two parts here, here and here, on both either side of your uvula, they will usually lift together. Okay, if only one lifts, the one that does not lift is the weaker side. Okay, like this one, when they say ah, this one, both sides normally should raise up, but only one raises up. Okay, so there's a problem with your soft palate. You have a problem with your cranial nerve 9 and 10. How about this one? What do you see here? Just after your soft palate there, you see these two big ones. This is your uvula. Don't worry about that. But you see these two big ones. Do you know what these are? These are tonsils, really inflamed tonsils. And do you know what this white thing is? That's pus. So this patient has infected or tonsillitis. Okay, you have purulent tonsillitis there, what they call ATP, acute tonsillopharyngeal infection or abscess, tonsillopharyngitis. Okay, anyway, check your partner, look at their soft palate, let them say ah, okay, and hopefully they don't have halitosis. Okay, cranial nerve 9, just remember SCM, sternocleidomastoid, and your traps. Okay, no biggie. You probably know how to test those. Last would be your cranial nerve number 12, your hypoglossal. From the term itself, glossal, this is your motor innervation to your tongue. So, everything that your tongue does, it's because of your hypoglossal nerve. Now, there are two sides. Again, remember, they basically push it out. Okay? They push your tongue out. So just like your lateral pterygoids, if you have a problem with one side, okay, let's say if your left side here is weak, you let the patient tell them, stick your tongue out. It would do like that because this one is not going to push so hard. This one is going to push normally. So you have a deviation there. So like this one, this deviates to one side. So if you see this, this is weak. This is normal. Okay, so just like your lateral pterygoids, your tongue will point to the weak side. Okay. Also, look at this. This tongue points to the weak side. You also have atrophy here. Okay. And sometimes you would see fasciculations because if it's a lower motor neuron hypoglossal nerve injury. Okay, now I just mentioned your lower motor neuron, and we'll probably discuss that. We will discuss that on the next few topics, lectures after this. So last is your hypoglossal. Just let them stick their tongue out or let them speak using their lingual voice components. You can let them, well, you could let them do that. You know that, try doing this. Some people can't do that. There's no problem with them. It's just genetics. Okay. So it points to the weaker side. Check for atrophy. So that's it. Basically, we're done from cranial nerve 1 to 12. What's important is you just know the function of each cranial nerve, and you have these reflexes that will help you check these nerves very fast. Again, knowing their function is very important. Don't just memorize the tests. Know what each cranial nerve is. Know the normal, so that you will have a good idea to spot what's abnormal. So we will end there, and I will see you again in the next succeeding topic, and that would be your spinal tracts. So see you then.